Use of ultrasound has expanded significantly in the musculoskeletal field in recent years for several reasons, including improved safety, portability, decreased cost, lack of ionizing radiation, and increased educational opportunities. Ultrasound can be used for diagnostic, prognostic, evaluative, rehabilitative, and interventional purposes. Ultrasound-guided procedures allow the clinician to differentiate between the type of pathology, the pathology location, about certain pathology details. Whether the pathology is acute or chronic, or if the ultrasound findings are a result of normal anatomical variations. Furthermore, ultrasound guidance enables the clinician to identify target structure for aspiration or injection with improved accuracy compared to conventional landmark-based procedures. Ultrasound-guided injections are also considered to increase patient safety and minimize discomfort and complications. Examples of ultrasound-guided interventions include injections, aspirations, and barbotage. However, to appreciate and understand the benefits and rationale behind performing ultrasound-guided injections, clinicians must have a basic knowledge of ultrasound-guided procedures alongside the terminology used. Therefore, the goal of this chapter is to introduce you to some basic knowledge behind successfully performing musculoskeletal ultrasound-guided injections. We strongly advise completing a SonoSkills Foundational Musculoskeletal Ultrasound course, also known as the MSK Bachelor class, prior to this ultrasound-guided injection course, so that you are competent in scanning the protocol positions of the upper and lower extremity joints. Without having done the foundational musculoskeletal ultrasound course, you will have a trouble in recognizing 3D anatomy, understanding the grayscale, handling the transducer, and you won't be able to recognize pathology. Furthermore, you will have difficulties in working with two hands simultaneously. Performing ultrasound-guided injections is like playing drums. It asks for fine, precise, and accurate motor skills. This course outlines the effectiveness of ultrasound-guided injection on soft tissues such as tendons, joints, nerves, and bursa. Advances in ultrasound technology allow static and dynamic real-time evaluation of musculoskeletal tissues and offer real-time radiation-free guidance for injections. The main philosophy behind ultrasound-guided injections is that one can screen the tissue to inject or not to inject, and if there is an indication to inject, then this can be done targeting pathological tissues. Undoubtedly, ultrasound guidance provides an additional margin of safety for injection techniques because the needle shaft, tip, and the target structure are constantly visible in real time. Depending on target localization, clinicians can easily select the technique of needle insertion and therefore avoid injury to nearby structures. It is important to consider that ultrasound guidance for injection should not be considered as precise targeting alone. It offers comprehensive guidance for the treatment process, starting with clinical decision making, as intervention could be diagnostic, therapeutic, or sometimes both diagnostic and therapeutic. The addition of ultrasound-guided injection requires a high level of anatomic and sonoanatomic knowledge, focus, manual skills, familiarity with the ultrasound system, image optimization, and substantial practice. Each soft tissue or bony structure has a different ideal technique, method of visualization, and needle choice. These details are developed in all part of this e-learning course. Ultrasound has no absolute contraindication and is generally considered safe but subject to the limitation and skill of the user. Therefore, we recommend to not only learn by studying e-learning, but to blend your learning experience with attending hands-on workshops. The indication for performing an ultrasound-guided intervention for any particular procedure should be considered, discussed during the informed consent, and documented. Indications are evolving in the literature and may be practice specific. Common indications to perform ultrasound-guided injection include lack of surface anatomic landmarks because of body habitus, proximity to neurovascular structures, a bleeding diathesis, atypical anatomy, deeper structures, or a need to avoid radiation exposure in someone who would otherwise undergo a fluoroscopically guided procedures. In some cases, the failure of a non-guided procedure or a need to be extremely accurate for diagnostic injection may drive the utilization of ultrasound guidance. Ultrasound guidance intervention is used in the administering of biologics such as platelet-rich plasma and stem cells. Ultrasound guidance is also used to perform prolotherapy. Furthermore, it can be used when performing the aspiration of fluids and the needling of tissues.